Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 200th episode, with a special show today dedicated to nurses, and we're also very fortunate to have back a great friend of the show, Dr. Jamie Skipper from Elevation Health, who also is a nurse by training. Welcome back to the show, Jamie.
Thanks, Justin. Always great and fun to be on your show.
Yeah, you're a great friend, but also a great industry strategist, public policy strategist. And we go way back from the days of on Capitol Hill together. I think it was about, 13 or 14 years ago? When were you on Capitol Hill?
Yeah, a long time ago. Before high tech came on board.
Yes. Oh, yeah. No, you're one of the greatest proponents we had on the Hill, and you understood health IT before it became kind of trendy. You were one of our biggest proponents. And so we're all, as an industry, we're grateful for your hard work, your fortitude, and moving health IT forward for what it can do for our country, and really to help it to bring to fruition all of its benefits in a lot of ways. So thank you for all of that. So why don't we take a couple? I mean, I always love to have you show. Our conversation can always go in so many different directions. But today I want to focus, a little bit on your world as a nurse, some of your training, and also just some of your experience where we are. And I know that you've been staying safe. But I would love to give your perspective on where we are in healthcare today, from your nurse perspective, but then also from how healthcare has shifted over the past 2 months with the coronavirus and COVID-19, and where you really see healthcare shifting from your expertise, even your time with NIH, ONC, and now in the private sector, building and helping companies of all sizes and investors in all lives. So let's start with that. So as a high level, where do you see, healthcare, how has healthcare shifted, I guess, from your perspective and opinion?
Yeah, well, I mean, as you were introducing the question, I was thinking to myself, man, that is like a 5-hour conversation right there. But
I know.
in the last 2 months, I would say to be on the positive side, if you can see anything positive during this, real grim time that we're all experiencing together, is the idea that we have really opened the world for virtual care. And it was always a nascent idea. Some folks were practicing it more than others, but this has really become a pressure cooker to kind of carry out the testing and use of virtual care in a way that we would have never imagined before. You have to do it to survive, really. And it is just such a cornerstone of how folks are delivering care right now. And so that is probably the number one biggest change that I would see being a person working in the technology sector for health policy.
Yeah, I agree. I mean, it's been out there. I've been working on virtual care for, over 10 years now.
Yeah.
But it's always been on the fringe. It's been something that we speak to. It's coming in the future. And I agree with you. For me, it's been front and center for the past 2 months as well. And one of my companies, we've deployed now 3,000 care providers on telehealth, and now bringing up hundreds on remote patient monitoring. And so it's exciting to see what we're able to accomplish. But again, these are very difficult times of the pandemic. But
yeah.
You and I both choose to be optimists, and hey, we got to find the silver lining. We got to find the positive pieces in all of this. And as we struggle through this, and as we hopefully pick ourselves up by the bootstraps as Americans, as a global society, I'm really hoping we are able to make some advancements with innovation, make some advancements with functionalities like telehealth, remote patient monitoring, remote care management, and because you and I even discussed this offline, I want to say last week about how actually you and I did a webinar together a couple weeks ago about how patients are also going to demand healthcare differently. So why don't we take a step back? And again, I want all this from the nurse's perspective. We're doing a special show focused, to hearing from the nurse, thanking nurses for their hard work. I mean, they do the job day in and day out. They don't get written about. They don't have the glory sometimes tied to it that doctors and others, but they are the fabric. They are the infrastructure to healthcare, nurses, and we love them and respect them for what they do for all of us on a daily basis. So let's take a step in that direction on the nurse side. Your thoughts on being a nurse, what made you be a nurse, and then maybe a nurse's view of some of this today.
Yeah, well, first, I would be remiss to say anything but a huge thank you and humble kudos to all of my fellow colleagues out there that are just in the trenches, in the war zones of battling COVID right now, risking their lives every day, the lives of their families. I am just moved to tears almost every other day, reading stories and keeping up with what's going on both in the hospitals and what nurses and other healthcare providers are going through in terms of trying to provide this care during really a kind of a war zone, and putting themselves and their families at risk and doing just amazing work. So kudos and thank you from the bottom of my heart. In terms of what made me become a nurse, well, I mean, my personal story is that I come from a family who has been in healthcare. My mother was an ICU nurse, a neonatal ICU nurse for almost 40 years before she retired. And I grew up as a kid who waited in the father's waiting room, waiting for my mother to get off of report. And I was well known in the nurses in the nurses station, and got a glimpse of the units as from before I was 10. And always grew up knowing that I wanted to be part of this world and be part of improving people's lives. I saw firsthand how people's lives were saved every day for, so long now. And so I'm blessed to have had that background. It fuels me all the time. And during the time that I did work as a bedside nurse, it was just some of the most rewarding, hard, but rewarding times of my life. I have the opportunity now to impact health delivery at a larger scale in terms of national policy now, over the last couple decades. And so it's been rewarding in that too. Definitely miss my bedside nursing and the opportunity to be hands-on with the patients, but really, again, kudos to the patient, to the providers that are really in the trenches right now.
Excellent, and thank you for that, and certainly thank you for your service. So now shifting to telehealth, remote patient monitoring, where we're headed now. What are some of your thoughts on? You've obviously been in the trenches here with telehealth, remote patient monitoring, and what are some, I guess, best practices or encouraging words? Because I think providers, I work with some of the largest providers. They're gung ho, they're flying forward. They've got fully deployed telehealth. They're deploying remote patient monitoring. They know this is the next frontier for even revenue. But for the 90% of the industry that's not there yet, what are some of the best practices that you would share with them?
Yeah, so the biggest potential with telehealth that I've seen for a long time that we're not realizing is preventative care. When we're talking, and this is from the days of being on Capitol Hill, it's been about how can we decrease the cost that we're putting into healthcare every day, and how do we improve patients' lives, and the quick almost simple answer is how can we improve preventative care? And telehealth is a huge, silver bullet to that, in that so many folks aren't going to spend 4 hours, 3 hours waiting in a waiting room when they pretty much feel well enough. And they're going to wait until, so a lot of times, something gets too serious. We
Right.
want folks across the board to live as well and healthy as possible. And telehealth is something that adds a level of convenience and access. And we've talked about access to healthcare forever. And telehealth really opens up that door to a type of access that folks don't really have until very recently. But then even now, the experience is very different, because it's again in this COVID pressure cooker period. But in an ideal world, to be able to say, hey, I don't feel that well, but I don't want to go to a waiting room where I'm either going to spread what I have if it's infectious or get something from somebody else. I can just talk to my doctor and tell them, something simple. And a great example of this is just even anecdotally from my own experience was the other day, I got a tick bite and I had a telehealth visit. It was a simple, quick conversation. I got my antibiotics and it was done in a quick telehealth visit. I didn't have to expose myself. If I had been sick in any other way, I didn't have to expose anybody else. I got my medications really quickly. And I also was able to care for my family, my kids, and I was able to carry on my work. I didn't lose half of my day. This is the reality that we want to see outside of the COVID period, and what I'm excited about in terms of the future of telehealth.
Yeah, you hit the nail on the head, and I've experienced something very similar, just from a standpoint of, and even my own experiences. I've always had a doctor that I've had telehealth with, but then I have a couple doctors that don't have telehealth, and I have to go sit in their offices. And recently I was traveling, and I just had eye surgery, or I had PRK, LASIK surgery, but I had something scratch my eye. But I couldn't go see my doctor, and he was not set up for telehealth. He just, we had to talk over the phone, and he couldn't look at my eye, and he had to go through what I was telling him. And I really wish, he could at least looked at my eye in some capacity, and he will, I'm sure, in the future. Now, this is just as COVID was hitting. But my point is I'm in frequent contact with my doctor, or if I'm traveling, I do have something go wrong. I reach out to my doctor. I don't wait, to your point. I don't just wait for something to get wet or worse, or I get, deeply infected. I learned at a young age. My sinus infections, if I nip those in the bud early on, I can knock it out in a few days. Well, earlier, before I learned all this, I would get sinus infections, and if it stays infected for a week or two, it sets in deep. It took me 2 rounds of antibiotics to get rid of it. But because now I have so that's just one example, but that happens with a lot of things. If you can nip it quickly, you can then stave it off. And also, you're not sitting in a waiting room potentially getting sicker, or like you said, exposing everybody to your sickness. So I think that's, and now the bigger point is everybody now is aware of that. You and I are anomalies. We're in healthcare. We adopt technology. We look for doctors who also adopt technology, to the best of our ability. And that's our ecosystem. But now a majority of America has been opened up to this. They're not. And also with COVID, and whatever the next, pandemic is, or epidemic, or something that happens, we are not going to sit in that waiting room. We know the convenience. We know the opportunity now with telehealth or any type of remote care. We as consumers, we as patients are really going to start to demand that. So that's something that, we have to, that's why I really want to do this show today. I really want to get the word out there for care providers to say, hey guys, it's not going back. If you look at it, it's not going back to the way it was. Yes, you will have patients come in, but nowhere near at the volumes that you used to, nowhere near as the daily amounts. And they don't want to. They're not going to seek it. They're over 65. They might be over 55. They may have one or more chronic conditions. So Absolutely. All of those reasons they're not going to come in. But yeah, what are your thoughts on that?
Yeah, no, we're doing this show dedicated to nurses, and I have to, give the shout out in terms of how nurses as a discipline, how we think is that we fundamentally we think about the patient in a holistic way. And that's why telehealth is so exciting to me, because for the first time, this solution fits into the holistic health story of the person. So your story and my story, it's touches on convenience, but there are so many stories out there where this is just very clearly a life or death situation, where folks might not be able to come in because they might not have transportation, they might not be well enough, and they won't come in. But if they have access to a telehealth visit, the doctor can lay their eyes on that patient and say, oh, I've got to, maybe I have to call an ambulance to get them in. Maybe I have to do these tweaks to their medication so they don't have a terrible episode of whatever chronic situation that they have. Maybe I can stop something compounding into something bigger than it needs, than it needs to be, and stop things from getting into needing very, very serious care. And so the idea of understanding where the individual is and meeting them where they are is just so exciting in the type of access you can have with telehealth. Now, what's also interesting with telehealth now, with what's happening with COVID, is that before, if you had a physician that didn't either have telehealth or didn't have telehealth yet, or didn't have the availability in terms of the time slots for telehealth, and you really want to be seen, a lot of folks were starting to see a doctor through telehealth, which is better than not going at all. But then the problem you had with that is that you had a continuity of care issue. And so now, with COVID striking and telehealth becoming such a huge part of almost every practice, that means that the chances of you having access to a telehealth type visit with your own doctors have increased greatly. And that also is super exciting.
Agree. And I completely agree. And one thing that I just noticed, I do a speaking engagement next week, and we were strategizing about it earlier today around how even specialists, how having now access to specialized care. So you're talking about increasing access. So it immediately goes, hey, there are specialists now. You can get some of the best specialists in the world that can actually treat you and help you, certainly here in America. And whereas you may not have had access to that person before because of all the regulations and credentialing that would have to happen within a state and state boundaries and so forth. So there are a lot of opportunities here. Now, again, that's very scary to a lot of business models, but that's kind of why, again, I wanted to do the show is business models are going to have to change. Policy is going to change at the state level, at the federal level, and you have to make sure that your practice of medicine, the way you seek care, you share care, is evolving with it. It's not we may not have all this openness. We may, but we may not. But certainly not going back to, oh no, we're going to shut down telehealth. We're only going to allow in-person visits. If you do that, the odds of you going out of business will dramatically increase by about 80%, because it's just patients are shifting with this. Patients are now going to go to where they can have this community care, where they're going to have this access to care, and you just got to be ready for it.
I've talked to hundreds of providers every day, and every single one across the board has said a couple of things. One is, after this is all over, all of our patients are going to demand this. I have heard that unanimously. And the other thing that I have heard unanimously is to ask about how to understand how to properly bill and understand the reimbursement around this. They want to know, they want to understand, they want to see policies change, they want to see policies support the future of telehealth opening up and telemedicine opening up.
So what best practices, because that is kind of the next frontier that we're tackling, because I think the modalities are out there. People are using telehealth. They're beginning to manage care remotely. They're doing remote patient monitoring in some capacities, but that's about to increase dramatically. And that's also the next frontier for reimbursement. That's the next frontier for capturing incentives. That's the next frontier of increasing a whole revenue stream into your practice to offset potentially some of these losses that are happening out there today. And so I think if you could share some best practices or ideas of how could care providers best navigate the next steps, what are the next 2 or 3 things that they should do to optimize this opportunity for their practice?
Yeah, number one is telehealth and RPM, and understanding that world and being successful in it requires you to understand RCM, which is revenue cycle management. You have to understand the complicated algorithms to bill for your practices, for your care delivery. And in order to understand that, it's never a quick answer as in what code should I use, but it's understanding what kind of practice do I have, what kind of care am I providing, what does my staff makeup look like, and then what are the codes that are available, both direct telehealth codes and now non-direct telehealth codes that match the type of practice that I have, and how do I bring that all together in order to have a revenue cycle management model that bills and gets reimbursed for telehealth at the maximum. Before all of this, so many practices looked at offering telehealth as a differentiator in terms of my practice is a practice that you want to be a part of or a patient within because we offer telehealth and that's a convenience to you. But it was still, a side fringe benefit. It wasn't a mainline delivery mode. And so the way that a lot of practices were looking to maximize their reimbursement around it was not taking advantage of all of the policies that are there that do allow for telehealth and telemedicine and virtual care. And now with everything that has changed, to be able to watch it, because we have a number of tsunamis that are coming. The first with when COVID first started was all of the opening up of the telehealth regulations, and now as the states open up again, then a lot of the telehealth regulations may revert back. But I say that with the caveat of that'll be hopefully what I'm looking at from a policy perspective, a temporary reversion. And so then all the policymakers, this is a prime time for policymakers across the board to see how well this is working. And I can, as a nurse, as a policymaker, and wearing those hats together, as well as an individual who has been a patient as well, I cannot see how the door is not going to open and open wide. So as we revert back to original policies, then the next waves are going to be watching what stays open and what continues to open up more. One thing I definitely want to talk about in terms of that is the importance of data. We now are privileged to live in a world where over 90% of hospitals, over 85% of physician offices are on some sort of EHR. Some sort of electronic health data is being collected. During this COVID period, some of that has probably gone down in terms of the data that's being collected because the regulations in terms of reporting has been relaxed a bit, but still there is data. Policymakers are going to be looking at this to see efficacy and to see cost effectiveness. And I can't imagine that it wouldn't show how wonderful of a solution and opportunity telehealth is, which will open up the policies yet again. And we really want to see, I really want to see providers, I want to see technology developers really be on top of that as they go through the forward journey of what, you know, healthcare is going to be, even in just the next 6 months or a year.
Right. Yeah, no, I completely agree. And I mean, you just covered a lot there. So, I mean, even the first part of your statement, you know, you and I joined a large health system discussion about 3 weeks ago and around remote patient monitoring. And we touched on a little bit of telehealth, but mainly is around remote patient monitoring and then understanding the complexity, because you're right. I mean, you focus a lot on telehealth, but our PM is the same. You've got to understand the revenue cycle management behind the remote patient monitoring strategy, because it's about what's happening at the federal level, but it's also a lot of value-based care contracts as well. And it's how you practice medicine. What is your staff makeup? What is your technology? What is your glide path to move forward? What devices do you have? What regulated devices are you using? There's so many components like that, but we actually we're out of time. You and I obviously always cover a lot of ground. So I'm going to have you back, Jamie. This conversation is just beginning, and I really want to get it out there. You know, this is the frontier. We've been working so hard on this for a long time. But I will have you back on air ASAP to continue on the conversation. So I appreciate you as always, Jamie and Dr. Skipper.
Wonderful to be on.
Got it. So I appreciate you taking the time out of your busy schedule. And thank you, everybody, for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio to respond to your comments from the show. If you missed any of this episode or want to hear more, all of my shows are always posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check out the new website that we launched at justinbarnes.com. Thanks, everyone. Have a terrific week and stay safe.